Hello, everyone. Thank you so much for joining us. Welcome to the 2020 American Diabetes Association Living with Diabetes Ask the Expert series. Today's topic is making the most of your healthcare visits. That means we are discussing all the tips and questions you need to prepare for those healthcare visits. My name is Shamira Robinson, registered dietitian nutritionist, certified diabetes care and education specialist, and director of nutrition here at the American Diabetes Association, and your host for today's program.
And my name is Jo Mandelson, registered dietitian nutritionist and associate director of nutrition, and your co-host for today's program. Remember that our Ask the Expert series is all about answering questions from our listeners. So start getting those questions ready. For those of you on the phone, press *3 on your keypad, and an operator will collect your question and place you in the queue so that you may have the opportunity to ask your question live. To participate online, type in your name and question in the field below the streaming player. Press the Submit Question button, and your question will come directly to us. Stay with us through the hour, and we will send you useful resources to help you live well on your journey with diabetes. In addition, we invite you to provide us with feedback in our 5-question survey at the end of the event.
Okay, now a little bit about why we're here today. Because of the link between diabetes and heart health, the American Diabetes Association, in collaboration with the American Heart Association, has launched No Diabetes by Heart. With support from founding sponsors, the Boehringer Ingelheim and Eli Lilly and Company Diabetes Alliance and Novo Nordisk, as well as our national sponsors, Sanofi, AstraZeneca, and Bayer, the No Diabetes by Heart initiative provides tools and resources for people living with type 2 diabetes to learn how to reduce the risk of cardiovascular disease. As a part of the initiative, the ADA is holding this free educational Q&A once a month. We'll cover information and tips to help you take charge of your health. The health and safety of all those we serve at the American Diabetes Association is always our top priority. The CDC has determined that COVID-19 is a serious public health threat. In general, people with diabetes face greater risk of complications when dealing with viral infections, and that's true for COVID-19. Current CDC recommendations to protect yourself state that you should wash your hands often. If soap and water aren't readily available, use a hand sanitizer that contains at least 60% alcohol. Avoid touching your face. Practice safe social distancing and put physical distance between yourself and other people. And cover your mouth and nose with a mask or a cloth face cover when others are around. The ADA encourages people with diabetes to follow the guidance of the CDC and to contact your medical provider if you suspect that you are showing symptoms or have been exposed to COVID-19. For our most up-to-date information, please visit our website at diabetes.org/coronavirus or call 1-800-DIABETES. That's 800-342-2383. Like many of you, we are also practicing social distancing, so we are proud to present this month's Q&A from our own living room. So, Jo, from my living room, I am going to pass it to you and yours to introduce our guest for today.
Well, thank you, Shamira. Yes, very proud to be here broadcasting from my living room, and very happy to introduce Dr. Doreen Casarino. Doreen is a family nurse practitioner providing primary and specialty diabetes care. She is actively involved in legislative activities at a local, state, and national level, which includes serving as the Florida representative to the American Association of Nurse Practitioners, the legislative vice president for the Nurse Practitioner Council of Collier County, co-chair of the Florida Coalition of Advanced Practice Nurses, and is currently the legislative vice president for FNPN. She was appointed by the governor to the board of the Florida Center for Nurses and is now serving as chair. Doreen is an active member of the American Association of Nurse Practitioners, which is a collaborative partner with this program. Wow, that's a lot of great experience, Doreen. Welcome, and why don't you tell us a little bit about yourself?
Hello, everybody. And as she said, my name is Doreen Casarino, and I've been a nurse practitioner for 20 years. And I'm passionate about diabetes care and helping people with diabetes be as healthy as they can be. I'm nationally board certified as a family nurse practitioner and also as an advanced diabetes management. And I'm really happy and excited to be here today to address your questions.
Well, we're so excited to have you, so thank you for that, Doreen. So while we're waiting for callers and online listeners to chime in, I'm going to go ahead and kick it off with the first question. We know that we should see our healthcare providers on a regular basis. That's very much a message that we talk about pretty often. But I want you to talk a little bit about how someone might prepare for a visit. Could you give us some tips on what you think might be helpful for people to prepare and bring to a visit?
Oh, certainly. That's being prepared is very, very important. And also not delaying your routine care with this COVID-19 that we're living in right now. But being prepared will help you to get what you need out of your appointment. As you know, they're usually about 15 minutes each. And being prepared can help you best utilize that time to get what you need. So I recommend that you know your goals for your appointment and write them down. What do you want to get out of that appointment with your provider? Are you supposed to have labs done before your visit? Typically, most people do. So if you do need them, make sure that you get them done in a timely fashion so that you can go over them during your visit and ask questions. Something that's really important is to bring an accurate medication list with you to your visit, including the over-the-counter supplements that you are taking, as well as the doses and the amounts of the medications and the supplements. Something else that's very important is bring your blood sugar log with you to review with your provider. That log can provide so much valuable information and help target different things that could help improve your blood sugar control. And also, don't forget, write your questions down before your visit. That way, when you're in there in the visit, you won't be forgetting something that you wanted to ask. And as we kind of talked about already, COVID-19 and this new reality, you might be having some visits from the comfort of your own home over the computer, your cell phone, or your tablet. So there are a few things to remember about a virtual or telehealth visit. You would plan for your visit just like you would with any other visit, whether it be the telehealth or the in face-to-face. But remember, there's the technology that's involved. So make sure that you're comfortable or have a family member or someone to help you if you're not, to have the technology ready. Don't forget to set the scene. So you're going to be having a visit with your provider, and you may want to have a quiet place where it's private and good lighting. Don't forget to take notes. So have a pen and paper handy so that you'll be able to take notes. And last but not least, feedback. Give feedback to your team and let them know what you liked about your telehealth visit, something that may help to make it better for the future, because I'm sure the team would like for you to have a good experience with your virtual or telehealth visit.
Thank you for that, Doreen. Those are very helpful tips, and I'm sure that we'll have a chance to dive a little bit deeper into some of those as we go on. If you're just joining us, welcome to today's Ask the Experts Q&A. Make the most of your healthcare visits. As a reminder, for those of you on the phone, press *3 on your keypad, and an operator will collect your question and place you in the queue so that you may have the opportunity to ask your question live. If you have questions about preparing for your doctor's visits or who should be on your healthcare team or anything along those lines, but you're participating online, no worries. All you need to do is type your name and question in the field below the streaming player. Once you press the Submit Question button, your question will come directly to us. Okay, let's head to our first caller. We are going to Gloria in Georgia. Gloria, you are live and you may ask your question.
Yes. Good afternoon. I wanted to know what type blood work when you go to the doctor, mainly is it creatine protein that relates to your heart? How often do you have to take that blood work? And
Oh, it looks like we might have lost you there, Gloria, but it sounds like you are wondering, when you go to the doctors, how do you know what blood work to get done, especially if you might have concerns about your heart? What are some of those labs that you should either ask about or request?
Okay, that is a really, really good question. And typically, that's going to be variable depending on your health and your various medical problems, and issues, and what medications that you're taking and that sort of thing. So definitely, you're going to want to ask your healthcare provider directly pertaining to your specific needs. But in general, most patients that I see them about every 3 months. And beforehand, we check their kidney function, their liver function, their blood sugar, their hemoglobin A1C, and then a cholesterol panel. And then, of course, once a year, we check some additional labs. And one of that would be the urine test to check for protein in the urine, and probably some other tests as well.
So do you think it might, Doreen, just a quick follow-up question to that. Do you think it might be helpful for someone to maybe keep a log of what tests they have had done so that they are able to bring that to a provider and have that discussion?
Whatever information that you can bring to your provider is very helpful. So frequently, I will recommend that patients get copies of their lab work and keep it in like a binder so that they have their historical numbers as well.
Oh, that's great. I love the binder idea.
That is a great idea. And just for those who may, they've never asked those sort of questions to their provider, can you just give a suggestion about how to go about either asking for labs or what labs they should have done, or asking for their records? What would be the best way to do that?
But for asking for their records, typically the front office staff can assist with that, and they're usually more than willing. And also nowadays too, we have the electronic health record, and you can typically access most of that as well through your patient portal. But as far as asking for specific labs, I would just ask, is there any specific labs that I need to do to check my heart health or my health of my kidneys or that sort of thing? And your provider should be very willing to have that discussion with you, that open discussion.
Thank you for that, Doreen. Now we are going to Linda in Chandler, Arizona. Linda, you are live and you may ask your question.
Listen, thank you so much. And thank you for providing this valuable service, by the way. I have two questions. I am seeing my physician assistant regularly, and do you think it's also a good idea for me to talk with a dietitian? And if so, do you know if there are dietitians who will give advice by phone instead of needing to make a visit in their office?
That is a really great couple of questions. I feel, and we have some nutrition on the call with us, that it's important for anybody living with diabetes to have regular appointment with their diabetes educator, and or they usually, or a lot of times they are dietitians or nutritionists. So yes, I think in addition to visiting with your healthcare provider, your PA, your nurse practitioner, or your physician, that you do need to have regular contact with the nutritionist or dietitian. As far as if there's anything in your area, or I guess it wouldn't even need to be in your area if it's by telephone, I am not aware of any of that, but I'm sure there must be, and I don't know if one of our co-hosts on the call
might be able to help. Yeah. So to follow up that question a little bit, I would say there are a couple of ways that you can get in touch with dietitians in your area. If you go to eatright.org, they have listings of dietitians. You can just put in your zip code and figure out what dietitians might be in your area. As far as telehealth goes, I think that's recently becoming a thing, so it really just depends on the dietitian. And then lastly, I would talk to your PA and see if your PA has any referrals for you, because they might have a really good connection that they're already working with that they can send your way, and that way you can make the connection that way, and you may, depending on your insurance, need a referral to get a dietitian. But I am all for the dietitian care and meeting with the dietitian to work on an eating plan. And that actually, I think that brings up a really good follow-up question too, Doreen. What are some other practitioners or providers that you might recommend someone have on their healthcare team?
There's quite a few that I recommend. First, you need your primary care provider, whether that be a physician, NP, or PA. But they're not necessarily the captains of the team. And actually, I believe that the patient is really the captain of the team, and that we're all of the providers are surrounding the person living with diabetes to help you. But you need I would recommend you need some good dental care, because dental care is so important for good nutrition, as well as preventing other complications. You would probably likely need a podiatrist to help with foot care, which is so important as well, and a diabetes educator, dietitian. I'm going to probably forget somebody. I said the podiatrist. And just general health, you need to have your gastroenterologist to do a normal colorectal screening on a routine basis. That's just for general health as well. And ophthalmology or optometrist for your diabetic eye exams, which I frequently have people will say, well, my vision is fine, but if you're having some diabetic complications in your eyes, you may not see it. You don't know it, and that's why the diabetic eye exam is critical.
Right.
Let's see. Did I forget somebody?
Well, another one that I can think of is a pharmacist is actually a great resource as well. You can talk to a pharmacist about some of your diabetes medication or heart medication.
Absolutely. I'm glad I did forget the pharmacist. And I frequently, people will ask me about, well, what about this medicine? Should I take it with this medication? And they're on multiple medications, and it gets very complicated and can be very confusing to people. So I frequently will ask them or recommend that they go and have a conversation and a consultation with their pharmacist. I think pharmacists are a big part of the team.
Absolutely. Shamira, did you have any other ones that you could think of?
Well, I think that gives us a comprehensive list. So, of course, just to sum that up a little bit, you have your dentist for your dental care. That is very important. Your registered dietitian to help you wade through the waters on figuring out what to eat and how often to eat. You have your pharmacist to help answer some of those questions about your medications, your diabetes care and education specialist, really to help with the day-to-day unpacking things, making sure you're getting your eye exams, your foot exams. There's so much that goes into caring for yourself and caring for your diabetes. But what I love the most about what Doreen said is really you. You are the most important member of that care team. You are the captain of that care team. And so making sure that you have people around you that make you feel comfortable, that make you feel heard, and that make you feel valued as you're moving forward in your journey with diabetes. So that brings us to an online question from Eva Smith. She says, my family doctor operates on the A1C number only. He never looks at my numbers when I bring them. When I mention I should see an endocrinologist, he tells me I don't need one. What do you think? So how do you think that Eva should go about navigating that sort of experience, Doreen?
So one thing with endocrinology is that there are very few endocrinologists, and at least in my area of the country, which is in Southwest Florida. So frequently, the primary care providers are the ones that are really helping with the patient and the person with their health care. So A1C is not the only part of the blood sugar panel, if you want to call it that, that's important. So it is important to look at the ups and the downs and the wide ranging of blood sugars. I would recommend that you take your blood sugar readings in, maybe even schedule a special appointment and not do it in one of your regular visits, but test your blood sugars frequently, write them down at the time with the time of the day, maybe how long after you've eaten and that sort of thing, and bring that with you to a special appointment and to review that with your physician and ask if this is within the range of acceptable sways in your blood sugars. I think that would be, if you do it in its own visit, it really highlights the importance of it to you.
I love that, and it goes back to setting those goals for your visit. So making it clear that this is what I want to accomplish during this visit, and really making sure you have everything and you're prepared to discuss that. Now, I know there are certain cases where people may have their goals of what they want to accomplish, but they either feel like their healthcare provider isn't necessarily supporting them in those goals, or they're not feeling very heard by their healthcare team. So when is a good time to possibly either, address those things or explore other options? What would you suggest for that?
Well, if you would feel like you could actually verbalize that, that would be good. Just say that this is important to me, and but if you're not able to verbalize it, then it might unfortunately be time to look for a new provider that does meet your needs. But I would try verbalizing first. You have a history with this provider and you don't necessarily want to switch, but there may come a time when you feel like you said, they're not meeting your needs, and you might need to look elsewhere for that, or ask for a referral to a diabetes educator, and then maybe you can get some of those questions and concerns helped through them.
Yeah, that's a really good point, that there are options that you can explore. So if ever you're in a situation and you feel like your needs aren't being met, then know you do have options and you do have control over that. So whether that's expressing your concerns and making those things heard, whether that is exploring other options and finding somewhere where you feel meets your needs a little bit better, or asking for a referral for someone who can better address those concerns. You have options on the table, and you are empowered to explore those things. Don't ever feel bad for doing something that helps you to meet your needs. We are going to go to our next question. We have Barbara from Michigan. You are live and you may ask your question.
Hi. Yes, I go to a large hospital in Michigan that has several clinics, and I attend the cardiovascular clinic and the oncology clinic, and I go to the eye clinic too, plus my general physician. And I have run into several times, for instance, when I was in for my yearly eye exam for the diabetes. Um, they were running behind, and whenever they're running behind, they bring out snacks for everybody in the waiting room, and they're always high carb, starchy snacks. And I realize that everybody is capable of making their own choices, but you also, might forget, and if somebody pushes it under your nose, you might be more likely to eat it, and the carbs will raise your blood sugar, and that would affect your eye exam. And I've also run into when I was having an infusion in the cancer center, they thought that I was having a blood sugar low. I was not. I was fighting off a migraine. And they tried to force me into eating crackers, and I said no. I know what my blood sugars are, and I'm not having but they were very insistent. So I took the package, and so she turned her back. I put it in my pocket rather than eating them. But it's very difficult sometimes to handle doctors or technicians from other clinics that don't really have a good understanding of diabetes, and they kind of put you on the spot in different situations. I've been polite, but sometimes I just think how many other people don't say anything and just do as they're told, even though they figure it might get them into trouble. Also, I've had
Oh, right. So thank you so much for that question. It sounds like you are experiencing something that so many people experience, and just having a lot of different providers or visiting a lot of different clinics, which means you're seeing different people, and they may have different recommendations for how to take care of yourself. And some of those recommendations may conflict one another. So, Doreen, what do you suggest for someone who may be seeing a few different people in their healthcare team, but they're getting recommendations that might conflict? So I know that our caller mentioned the cardiac clinic and these different clinics. So what if one is maybe focused more so on her blood pressure, and one might be focused more so on her blood sugar, and one on sustaining her weight? And so those recommendations might conflict. How does somebody handle that?
And I'm sure that happens very frequently to people because of all the different providers that they do see, and as they are focused on mainly on their main thing. But I think it comes back to being prepared for your visit. When you go to this clinic that has all this big office clinic, they have different offices that you're going to, and they typically run behind. I would recommend to bring a suitable snack with you so that you're prepared if there is a delay, so that you're not tempted to indulge in the snacks that it's very nice that they're providing them, but they may not be their best snack for your situation. I would say bring a suitable snack with you, and also make sure you bring your blood sugar meter. So if they think that you're having a hypoglycemic event, you can say, let me check my blood sugar. I don't feel like I am, and then you can check your blood sugar and then be prepared for that. So I think a lot of times it comes back again to that being prepared and having your plan B with you.
Yeah, I think that's great. And just emphasizing the point that, and what I appreciate so much is that empowerment feeling of knowing when to speak up. You are the captain of that team, and you know your body, you know your healthcare, you know your health and how you're feeling. And so Of course, taking the recommendations from your provider, but never being afraid to share what it is that you're feeling or experiencing in contributing to that conversation and making sure that your voice is heard in that conversation. Okay, we are going to our next question. We have Rosemarie in Pennsylvania. You are live and you may ask your question.
Okay, I have a question. I have several different providers, and now that this virus is in effect, I don't have the smartphone or a computer, and now I can't get all my results of my test. And like I have a family doctor, the PCP, a kidney doctor, gastroenterologist. He takes care of my liver and my digestive issues. A podiatrist, which I don't have blood tests for him. And I have an ophthalmologist, and I had trouble getting an appointment, but I got one now because they didn't do anything. I finally got a dental appointment, and I take all kind of pills, but I would like to get my blood test and stuff, and it's hard to get them because I don't have a portal now, and my diagnostic center that takes my blood, you can't even get your blood test results from them. So I was wondering if you had any advice about that. And
Well, I know that
Thank you for that question.
Go ahead.
No, go ahead, Doreen.
I was just going to say that this new world that we're living in with the COVID-19 has changed so many things in our everyday lives, and including how we do things. And like we've talked about briefly, the telehealth is one of those new realities, but it's made it difficult to continue your usual care, your routine care that is so important that you just don't want to delay anything. But as far as getting your results, I would recommend that you contact the various offices, call them on the telephone, and just ask them to put them in the mail. There's still mail going out, so they could put the results for you in the mail and send them to you, and then you'll have them. That should do it. They should be willing to do that for you. And I mean, we're doing things now that we've never done things this way before. So I think that would probably get you your results. But if you are having trouble connecting with your providers because you're not going into their offices, or you don't have the technology to do the telehealth, there are some offices, I know, some larger offices that are actually having providers, nurse practitioners doing home visits for people that cannot use the telehealth or cannot get into the office. So that may be another option if you're having trouble actually meeting with your healthcare provider.
Yeah, I think that's a really great point. We're living in such a different age right now. We're getting new information. Things are rapidly changing, but I also think that providers are being a little bit more flexible and understanding. So I think just reaching out to your provider and having a conversation is a great start, and maybe mailing is not going to be an issue at all. So thank you so much for that, Doreen. I want to remind our listeners that at the conclusion of the Q&A segment, you're welcome to stay on the phone or online to complete a short 5-question survey. Your feedback is really important to us and will help inform future planning. You all have been asking really great questions, so please stay on the line. Please continue participating. And don't forget, you can press that *3 to submit your question, or if you're online, type your question in the queue and press the Submit Question button. All right, Shamira, I'm going to pass it back to you for our next question.
Okay, we are going straight to Kathleen in Texas. Kathleen, you are live and you may ask your question.
Yes, this is Kathleen. I was calling because I was wanting to know a little bit about cholesterol. My pharmacist says I need cholesterol medicine, and my healthcare provider says I do not need cholesterol medicine because my cholesterol is not high. So I want to know what's the difference, a little bit about cholesterol.
So that's a really good question. Do I or don't I need a cholesterol medication? And some of the national guidelines would say that every diabetic should have a cholesterol lowering medication. And I'm sure that that's probably where your pharmacist is giving that advice from. So I would recommend that you talk with your healthcare provider and ask them, the pharmacist says that I need this medication, and do I need it? And I think it's a good conversation for you to have with your healthcare provider.
All right, thank you for that. Now we are going to Claudette in Baltimore, Maryland. You are live and you may ask your question.
Yes, I had a question about the virus and diabetes. Just how are we affected, those of us who have the virus, and why are we at such high risk? We are in that high risk category. Why is that?
So with diabetes, people with diabetes are at high risk to develop and have maybe worse complications from different viruses in general. And I believe from what the research and the experience of the people that are actually carrying on the boots on the ground with patients with COVID-19, that diabetics have been having an increased risk of complications, as well as actually acquiring the COVID-19 infection. So that's why it's so important that you follow the CDC recommendations as far as the hand washing, the social distancing, wearing a face covering when you're around people, and also to avoid crowds, don't touch your face, and those kinds of things. So it's very important to stay at home as much as possible in order to prevent your risk of contracting this terrible virus that we don't have a vaccine for now. So the only thing that we can do to protect ourselves is by following the CDC recommendations.
Yeah, thanks for that, Doreen. And you're absolutely right. Once someone contracts COVID-19, if you already have diabetes, that increases your risk for a lot of those complications. And just in general, with us being home more and how everything has shifted with COVID-19, if you think about it, you're home more. A lot of times that means you might not be as active as you once were. And so that change in your activity levels can also have a big impact on your blood sugar, but it can have an impact on your heart health as well. Think about your food choices. Sometimes cooking at home can be great for some people, but for other people who may not be as mobile, who may not have, access to the same sort of foods or the frequency of meals as they did before things changed with COVID-19, it could impact your food choices as well, which has a big effect on your health. And so things like this, even just being home and maybe not being able to visit family or visit friends as much, can have a big effect on your mental health. And all of those pieces go into how you manage your diabetes. So keeping an eye on those things as well, because we do want to make sure that we are reducing risk for contracting COVID-19, but we also want to make sure that we're keeping a especially good eye on things like your blood sugar and your blood pressure and your heart health during these times, because a lot is changing. And going back to your healthcare team, we mentioned so many different providers that go into that, but I do just want to highlight that your mental health is a key component too. So having a mental health professional, whether that be a counselor or a therapist or psychologist, psychiatrist, all of those people can help you during times where you may be feeling overwhelmed, you may be feeling anxious or depressed, or experiencing some diabetes related distress. All right, Joe, do you want to go to our next question?
Yeah, thank you for that, Shamira. So we have Robin who asked an online question, and she's asking, my physician is only doing A1C test once a quarter and not having me do daily or routine blood sugar tests. Is the A1C sufficient? So it sounds like she just wants more information on what A1C might be and if she's getting it enough and if maybe she should be doing routine blood sugar tests.
So that's a really good question, and I believe that would depend on your health and your diabetes. So it's different for every person, and also the management of your diabetes is different for each person as well. But I would talk with your provider and ask them for a prescription for a meter so that you can do some tests. Tell them that you would like to see if you eat a certain food, what happens, how does that impact your blood sugar? Or if you have a certain activity, how does that impact your blood sugar? And just ask them for a prescription for a meter, or ask them for a meter and a prescription for the strips, because he may or she might even think that you are testing and not even aware that you aren't able to test. So I would just ask them for a meter and start testing.
I love that message. Going back to you're your biggest advocate. So, it's great that the question was asked, and now let's bring it to the provider to ask a little bit further and probe a little bit more. So, Shamira, I'll pass it back to you.
All right. We are going to Sharon in Miami, Florida. You are live and you may ask your question.
Good afternoon, everyone. So I have been listening in. A part of my question was already addressed. I am a diabetic type 2, and I wanted to know, if you are taking your regimen according to prescribed by the doctor, but yet the numbers still fluctuate, what advice or what options do you have? And secondly, is a diabetic considered underlying?
I'm not sure I understood the second part of that question. Do either of the co-hosts have any thoughts on that?
So I am not completely sure. I think it might have been getting to underlying conditions and risk. But if you are still on the line, call back in and we'll try to get some clarifications. But in the meantime, we can definitely focus on that first question. So do you want to take a stab at that one, Doreen?
Sure. And that was, she was talking about fluctuating blood sugars, correct? Because I was kind of focusing on the second part.
So she's doing everything as, prescribed, but she's still seeing some fluctuations. So she wants to know the best way to go about that. And the question that the screener had on the screen also mentioned, her needing some labs, but not wanting to go into the office physically to have those performed. So wanting to know if there was an alternative. So let's focus on that for the second question for now.
Okay. So for the needing some labs but not wanting to go into the office, that would be a question that I would pose to your healthcare team, your healthcare provider. Like we've talked about, there are we're doing a lot of things differently these days. There may be a lab that actually can, or a home health agency that actually can come to the house to actually draw the labs and have the labs taken. So I would ask your provider what's available in your community. But that definitely gets back to getting prepared and being prepared for your visit. As far as the blood sugars fluctuating, that's being prepared. So bring a log of your blood sugars. You might want to test before your meal and then an hour or two after your meal, and then you can have that comparison of what the fluctuation is, and ask your provider, is this acceptable fluctuation and swing in your sugar? So having all the information and being prepared for your visit will definitely make that visit be more helpful for you and help you meet your goals. And by being prepared, it helps you to be more empowered to do that.
Absolutely. And even with those fluctuations, we talked about being prepared and bringing your list and your log. And I think another important thing to highlight is the more information that you can comfortably add, the better it will be in that preparation. So you have your list of your different blood glucose readings. If you can add, yes, you had your mealtime, but what did you eat during that meal? And you could start to notice some trends. Maybe when you eat a certain food, you see those numbers tend to go a little bit higher. So you can ask questions specifically about that thing. You can also track things like your activity. So maybe if you were moving more that day, maybe you exercised that day, then you can make a note of that too and see how that's affecting those blood sugar readings. And all of that information is going to help your provider dial in to what's going on with those numbers and why they might be fluctuating. Next, we are going to Rose Peters in New York. Rose, you are live and you may ask your question.
Yes, I just recently became a diabetic. I know that sounds funny, but all of a sudden I got a blood test back and I had to go to the emergency room because it was like 455. They brought it down to 297. Then I saw my regular routine doctor, and on Metformin, HCl, 5 milligrams, once in the morning, once in the evening, Jardins, 10 milligram, once a day. But my next visit to see my physician isn't until August 28th. Is that sufficient time, or shouldn't I be seen more often than that there after becoming just a diabetic like that?
So each situation is going to be unique, and so you would have to look at it in that way. And if you don't feel comfortable, I would recommend that you write all your questions down and call their office and get a sooner appointment. You don't, just because they didn't schedule you till later in August doesn't mean that you necessarily have to wait till then. If you're having concerns or questions, be your own advocate and call and get in sooner. Or there may be somebody else that they can refer you to as a part of the team, such as the diabetes educator, or there could be the PA or the nurse practitioner in the office that you could go in and just talk with them about what you're seeing, what you're thinking, and what you're feeling, in order so that you feel more confident and more comfortable with your health care.
Yeah, and it could be another reason to call them and have this conversation with them too, is it could be that, a lot of practices has changed their hours and their staffing, so that might be the soonest appointment they might have been able to get for you, but maybe there might be a cancellation. So maybe you can get on a cancellation list and get in a little bit quicker if that's what you're interested in doing. So I would definitely encourage you to give them a call, Rose. And another thing that I wanted to point out, Rose, I think this is a great point too. ADA has a lot of great resources for people that are recently diagnosed with type 2 diabetes. One of them is called the Living with Type 2 Diabetes program. And with this program, you receive emails and e-booklets that provide you information with things on emotional health, eating healthy, physical activities, just overall wellness tips for living with type 2 diabetes. And I think that's a great place for you to also start. So if you want to get more information on that, you can definitely go to our registration page and sign up. The website is diabetes.org/experts. Again, that's diabetes.org/experts. All right, Jamira, I'll pass it back to you for the next caller.
Okay, we are going to Catherine in Virginia. You are live and you may ask your question.
Yes, this is Catherine. I had a question about the difference between high cholesterol and high triglycerides and what the different diets for each would be.
So I think that's probably a question that a lot of people have, and it can be confusing. But the triglycerides are part of the cholesterol panel, and oftentimes the triglycerides are elevated in people with diabetes. And typically, what I see is as their blood sugars improve, the triglycerides tend to improve as well. That doesn't mean that people may not or may need medication, but to help with their cholesterol and their triglycerides. And but that would be a good question to bring up to your provider to see if you need any specific medication or diet for your triglycerides or your cholesterol. But typically, the nutritionist and dietitian can really help a lot with helping you to formulate a meal plan that fits all your healthcare needs, cardiovascular, diabetes, etc., and also if there's any need for weight management.
Absolutely. And, you know, with that, in general, from that nutrition perspective, we always want to encourage just a balanced approach. So at ADA, we like to start with something called the plate method. So when you're thinking about building your plate, what you want to do is take that plate, if you're visualizing it in your mind, and just cut it right down the middle. So half of that plate, we want to be our non-starchy vegetables. We want to make sure we're getting a lot of those things. So when you think about non-starchy vegetables, that includes all of your greens. So like your salad greens and mixed greens, you have carrots, broccoli, cucumber, tomatoes, all those sorts of things. You want to fill up that plate as much as you can with those foods. On the other half of that plate, we want to take it and split that plate into quarters. So 2 small sections on the other half of the plate. One, you want to focus on your lean proteins. And so some examples of lean proteins can be things like chicken, turkey, fish. You also have some vegetarian options that you can put there as well. And then the other small section is going to be for your starchy foods or your carbohydrate-rich foods. So that includes your rice, pasta, bread, but also thinking about your starchy vegetables like corn and potatoes, sweet potatoes, beans and lentils, and also fruit. So that would go into that small quarter section of the plate. So these are just general tips for building a balanced meal. But as Doreen said, this is a great place to ask for a referral to see a dietitian. And anyone who is diagnosed with diabetes should be seeing a dietitian and should be able to ask for a referral, because sitting down with that dietitian, they'll be able to look at what you're having now, where you're starting at, and build a plan based on the foods that you like, the foods that you regularly eat, and really something that's customized to you and your needs and what you would like to see. So I think that is a wonderful approach. And next we are going to Rosina in Raleigh, North Carolina. You are live and you may ask your question.
Hi, I want to know, does the blood glucose fluctuations impact your vision, and when should you request an eye checkup?
So blood fluctuations, I've had people that they do tell me that they do notice their vision gets blurry when their blood sugars are elevated. And also sometimes when their blood sugars are a little bit low, they'll notice that their vision is just not quite as sharp as it is when their blood sugar is not too low. Every diabetic should have a eye exam. According to the ADA guidelines, I believe that the type 2 diabetics, when they're first diagnosed, that they need to have one. I believe it's within the first 5 years, and then on an annual basis. But I typically will have them. I don't have them wait quite the 5 years, but I mean it's all individual too. If you're having a lot of visual issues, then you need to probably have your eyes checked by a eye professional, sooner. And but that's at least once a year is what I recommend.
All righty. So it looks like we have time for one more question. So we are going to go to Geneva in Georgia. You are live and you may ask your question.
Good evening. How you doing? Okay, my question is, I'm a diabetic. I'm a type 2 diabetic, and I also have heart trouble. And I was trying to see how often are you supposed to test your blood sugar before and after you eat, and how often you supposed to see a heart, your diet. If you see a dietitian, do you need to see to go to a diabetic classes or a heart special? A diabetes specialist. And I think that's it. I forgot what it was because I've been trying to do this last month, so I'm trying to get it all this time. So can you tell me? Do I need to go to it? I've got a diabetic doctor supposed to be coming on board sometime next month, and also I was talking to a nutritionist, so I was trying to see if I need both of them or just one of them.
So I think the question is basically how often does she see the dietitian and the diabetic specialist? But I think they're interrelated. So I think you need your diabetic specialist, and you also need your dietitian because they will complement each other in order to help you with your diabetic management. So I would say that you should need both, and the frequency of those visits is very individualized based on your needs, whether it be more or less frequent.
And I think the key word there is individualized. I think, when it comes to someone's care, it really depends on who they want to have on their team and who is recommended on their team, but also, what questions you might have. So a dietitian, an eye doctor, a podiatrist, mental health, we talked about a lot of people there, and they all kind of complement each other, and you individually taking control and keeping a log and all of that is going to play such an important role in your diabetes care management. I think the other part of her question that she might have asked, and I think we have a little bit of time that we can hit this before we have to close out. She was wondering how many times should blood sugar be checked?
Again, that is individualized based on your control of your blood sugars at any given point in time. You may need to be testing more frequently or less frequently. If you're ill, you may need to test more frequently. If you're changing your therapy, you might need to test more frequently. So that's very, very, again, another very individualized frequency. So it's not. I would talk with your healthcare provider and get their recommendation as far as how frequent you should be testing.
For sure. Those are great points. Well, thank you so much, Doreen. This wraps up our last question for the session. A few items before we close today. Consider staying online or on the phone to complete a short 5-question survey. We want to hear from you all and hope you will take a few minutes to provide us with your useful feedback.
To help you feel comfortable and confident about your ability to manage your diabetes and your heart health, we encourage you and your loved ones to talk to your doctor and dietitian and the rest of your healthcare team about your risk. Go to knowdiabetesbyheart.org and learn more. Register for the next event at diabetes.org/experts. Sign up for diabetes education near you, and sign up for ADA's free Living with Type 2 Diabetes program. All of these links are on the Ask the Experts registration webpage, which is diabetes.org/experts. If you have questions about this event, want resources to find diabetes education classes in your area, or would like to receive an information packet to learn more about living with type 2 diabetes, you are welcome to contact us at askada@diabetes.org or call 1-800-DIABETES. That is 1-800-342-2383. If your question was not answered, leave a voicemail with your question and email, and we will have an expert respond within the week via email. Thank you for listening. Or you can call back to the call center for a phone response at 1-800-342-2383. Thriving with diabetes takes a village, and we are here to support you. Special thanks to our expert, Dr. Doreen Casarino. I am Shamira Robinson, and on behalf of the ADA team, we want to thank you for joining us today. We look forward to connecting with you at our next Ask the Experts event, Diabetes by the Numbers, August 11th at 2 p.m. Eastern Time. I'll turn it over to the survey portion to close out our program. Best wishes for good health.
All right. Thank you again for joining us today. We appreciate your feedback on today's event. To provide your responses, press the corresponding number on the keypad of your phone. And for participants online, please click on the poll section below the Ask a Question form and click to submit your responses. Okay, here is our first question. Overall, how satisfied were you with today's event? Make the most of your healthcare visit. Use a scale from 1 to 5, with 1 being not at all satisfied and 5 being very satisfied. And I'll repeat that one time for you. Overall, how satisfied were you with today's event? Make the most of your healthcare visit. Use a scale from 1 to 5, with 1 being not at all satisfied and 5 being very satisfied. And while we take a moment for the next question to come up, I'd like to remind you about one of our programs supporting people living with type 2. If you are recently diagnosed or could benefit from a refresher, consider signing up for ADA's free program, Living with Type 2 Diabetes. Participants receive information via email and e-booklet throughout the year-long program on topics including emotional health, eating healthy, and physical fitness, as well as tips on managing and living well with type 2 diabetes. All right, and on to our next question. Which of these healthcare providers can be on a healthcare team for individuals with diabetes? Press 1 for eye doctor. Press 2 for mental health professional. Press 3 for registered dietitian nutritionist. Press 4 for nurse practitioner. Or press 5 for all of the above. And I'll repeat that one more time. Which of these healthcare providers can be on a healthcare team for individuals with diabetes? Press 1 for eye doctor. Press 2 for mental health professional. Press 3 for registered dietitian nutritionist. Press 4 for nurse practitioner. Or press 5 for all of the above. And before we go on to question 3, we'd like to let you know that if you missed a part of today's event or would like to just listen again, we have full recordings available by phone. You can call the toll-free number, which is 866-686-8240 to hear the latest recording. Again, that phone number is 866-686-8240. All right, and here is question 3. Which of the following statements is true? Press 1 for regular visits to the dentist are important for diabetes care. Press 2 for a diabetes educator can help you develop skills to manage diabetes. Press 3 for pharmacists can answer questions about diabetes medications. Or press 4 for all of the above. And let me repeat that one more time. Which of the following statements is true? Press 1 for regular visits to the dentist are important for diabetes care. Press 2 for a diabetes educator can help you develop skills to manage diabetes. Press 3 for pharmacists can answer questions about diabetes medications. Or press 4 for all of the above. And before we move on to the next question, we would like to remind you again that our next Ask the Expert Q&A event, called Diabetes by the Numbers, will be on August 11th at 2 p.m. Eastern Time. Our guest expert will discuss the meaning behind all the different numbers to track when it comes to your diabetes management. To register, go to diabetes.org/expert or contact our call center at 1-800-DIABETES, and that's 1-800-342-2383. Okay, on to question 4. As a result of this event, how likely are you to schedule a visit with your healthcare provider to talk about the link between heart disease and diabetes? Press 1 for not likely, press 2 for somewhat likely, or press 3 for very likely. Let me say that again for you. As a result of this event, how likely are you to schedule a visit with your healthcare provider to talk about the link between heart disease and diabetes? 1 for not likely, press 2 for somewhat likely, or press 3 for very likely. And while we wait for the last question, remember that a diabetes self-management education and support program will focus on your concerns about diabetes. This program will empower you with the knowledge and skills to help you manage diabetes. You can find a link to an ADA-recognized diabetes education program at the bottom of our Ask the Experts webpage, which is diabetes.org/expert, or you can call our 1-800-DIABETES phone number to speak to a member of our call center and find a program near you. All right, here is our final question. As a result of this event, how likely are you to sign up for or continue to participate in a diabetes self-management education program? Remember, diabetes education programs usually require a referral from a healthcare provider. Press 1 for not likely, press 2 for somewhat likely, or press 3 for very likely. And I'll repeat that one more time. As a result of this event, how likely are you to sign up for or continue to participate in a diabetes self-management education program? Press 1 for not likely, press 2 for somewhat likely, or press 3 for very likely. And that wraps up our survey questions. So thank you for staying with us and providing your feedback on today's event. We offer many thanks to today's expert, Doreen, as well as our support vendors and sponsors, and the No Diabetes by Heart collaboration. This concludes today's program, the Ask the Experts Q&A series. If you have your email address on file, you can expect to receive an email with resources from today's event. Alternatively, you can find links to these resources on our website, which is again diabetes.org/expert. If you click on the July 14th, 2020 event page, you'll find recordings from this event, as well as a link to those resources. And lastly, if you have any additional feedback for our team, please stay on the line to leave us a message. Thank you.